Hello, family. God bless you wherever you are tuning in across the world. That's right. It's time for Senior Talk with Clara Hubbard, your resource and information show for people getting better with age. Well, let me tell you, you don't want to miss it. Guess what? Open enrollment, AEP, however you call it, is around the corner. And our community partners are joining us today. Zing Health. You don't want to miss it. Everyone stay tuned. We got to take care of our opening, and our special guest is joining us today. If you have questions or comments, please leave them in our Facebook link, or you can also send them through we're on Twitter as well as on YouTube. So we'll take all your questions and comments at that time. Everyone stay tuned. Senior Talk is live. We'll be right back. All right. God bless you, everyone. Thank you for tuning in to Senior Talk with Claire Hubbard, your resource and information show for people getting better with age. Well, let me tell you this. I am extremely excited for this broadcast. I'm telling you this. I have been in the community this past summer, and let me tell you, right beside me and right with me, if I could say, has been Zing Health. We have covered Indiana and Illinois. We have done it, and we've started our partnership earlier this summer. But let me tell you, it is by no coincidence they are joining us back today. They are our lead partners for open enrollment. And let me tell you, we had the pleasure of being in Indianapolis. We'll talk about that later. But I asked this beautiful young lady to come on board and join us today because she was one of the panel when we were at the Black Women's Expo here in Chicago. And I tell you, she brought it, the knowledge, the understanding, any and all questions were answered. We had a great time there, and it was our first experience with the Black Women's Expo. So I said, hey, let me call the big guy. So I called my friend Stephen. We love you, Stephen Martin, and Dr. Whitaker, of course. We love you. We love you. And so I said, I need someone who can lead the charge and break it down to our community about the quality of life that they deserve and that they are entitled to. So here we are today. Welcome to Senior Talk, Miss Saadia Selvie. Welcome, welcome, welcome. Yay!
Thank you. Thank you so much, Clara. I really appreciate being here. And yes, the Black Women's Expo was amazing. We were able to share a lot of great information, both Dr. Trent Haywood and myself. It was amazing.
Dr. Trent rocked that stage. He rocked that stage. He was awesome. And so what I was excited about is because as I tell people, I have to be very careful into whom I work with in the community. My name is on this. And so let me be very clear. I have been with Zing for close to some odd months, but there has all been a level of excellence as the service. I mean, we're not talking just one event. Everyone has a consistency of being and paying attention to our beloved clients and future patients. So I just want to put that disclaimer and that comment out. That's on behalf of Senior Talk. So this is my choice of open enrollment information. We're going to have a series that we're going to go through December. We're going to get everyone in tune to events where we're going to be together. But I'm very excited for that. Now, the big deal is this. AEP is just around the corner. It can be intimidating to some. Hello. And it could be, well, I don't know if I'm gonna, can I, what is all that stuff. So from your position, first introduce who you are, because you're so cool. I think you're awesome. And you rock that panel. That's why I said, please bring her on board to do our new series that we're kicking off for AEP. So introduce yourself. Yes. And then let's talk about your title with Zing, and let's get into the meat of why we're here today.
So my name is Saadia Selvie, and I've been in the healthcare space for a little over 22 years. And I've been in the Medicare Advantage space for about 16 years now. I am the Vice President of Sales and Marketing for Zing Health. And Clara, I have to tell you, I definitely echo the same sentiments in terms of what you've experienced with some of the leaders that you've met at Zing Health, which is one of the reasons that I'm here. They are committed to serving our communities and ensuring that they also have health equity. That's one of the biggest objectives in terms of Zing Health, is ensuring that people like us, people that look like us, and underserved communities as well, get the healthcare insurance that they need, and it's quality healthcare insurance.
Well,
And so,
I like that term, health equity.
yes, yes.
Hmm.
Dr. Whitaker definitely pinged that particular quote, because that's the goal. Dr. Whitaker is the CEO and founder of Zing Health, and he's a medical doctor and was in the Chicagoland area for a number of years. And so he has firsthand experience of some of the disparities in healthcare, in terms of services, quality, that our seniors, that our community is actually receiving. And so we've designed Zing Health in a way that really speaks to not just the senior population, but the Medicare population as a whole. Because as we know, Medicare recipients, it's go beyond seniors. It's for people with disabilities, people with end-stage renal disease, who have end-stage renal disease, Lou Gehrig's disease. So there are a number of individuals that actually qualify for Medicare. And that's what we want to talk about today, because it is an important enrollment period.
Yes, it is.
Enrollment.
Let me say this. You hit it on the head. And, if we could just take a few moments for Dr. Whitaker. I had the pleasure of interviewing him a few months ago, and he is a champion just for our community.
Yes.
Across the board. I mean, he talked about the I think it's Project Brotherhood or some program for men. And I said, well, where would that concept came from? He said, well, we knew that men, in order to get them to come to the doctor, it had to look like something they would be comfortable with. So they have the barbershop and they have counseling. And I said, wow, that's a unique idea. He said, because sometimes when men go into medical facilities, it's all bright and it's more geared towards women. And so for him to have that success is so awesome. And just to make that analogy was really good. So let's do this. We're going to show people in the community, because we've been in these streets, everybody. We have been on the ground. And I am asking everyone to do me a favor. Check out our website, myzinghealth.com. The number is 833-946-4937. Everyone stay tuned. We're going to show a quick commercial of our community partnership here on Senior Talk with Claire Hubbard.
Zing Health is turning 65 and dancing the night away. Zing is getting your extra steps in. Zing is your trusted partner helping you navigate the Medicare maze. At Zing Health, we listen patiently to your health needs, personally guide you to the best Medicare Advantage plan, help you maximize your benefits so you can start optimizing your health today. Are you turning 65? Amazing starts here. Explore how Zing's Medicare Advantage plans help you feel amazing. Call 844-ZING for us or go to myzinghealth.tv.
All right, that's a great way to roll into our next segment. So there are over 10,000 people turning 65 every day. That's why I use the term people getting better with age. I tell you, that's my term. That's my term. So let's talk about your title. You, as I mentioned, were dynamic at the Black Women's Expo, and just we had a real true conversation about the open enrollment period. I think what I want to start on is how we can ask our future clients and future Zing members to not be so intimidated about the process, because there is help. Let's start there.
Absolutely. And we've coined that in what you just explained is navigating the Medicare maze, because it definitely can be a maze, as you heard Dr. Terry Mason talk about at the Black Women's Expo.
Yeah.
So it can be an intimidating process, which is why we have Medicare advisors at the number that you listed. And these Medicare advisors are very educated about Medicare, and they will help Medicare recipients understand what their options are. And they're not trying to sell them, they're trying to educate them on what their options are so that they can make the right decision for them as an individual.
Yes.
It's definitely an individual evaluation, and it's based on the person's needs. And so it's never a cookie cutter situation, because every person has their own individual specific needs. One of the things that I love about Zing Health is we've created and designed plans that work, number one. I spent over 16 years in the Medicare Advantage space. I went from very big name carriers, and I've experienced some of the pain points of different plans, of Medicare plans. One of the things that we've been able to do at Zing Health is we've been able to eliminate some of those pain points, not only from a member standpoint, but from a provider standpoint, because Dr. Whitaker has firsthand knowledge of the pain points between the physician, the insurance carrier, and the member or the patient. And so we've looked at the things that impact the members. We looked at the things that impact the provider, and we've been able to put together very strong plans that ensure that our members have access to the services and quality care that they need. And so that's the first thing about Zing Health that really differentiates us in the industry. And we have leaders that speak to our specific situations. When you talk about social determinants of health are one of the things that we really, really focus on at Zing Health, because social determinants of health are non-medical factors that impact 80% of people's outcomes, healthcare outcomes. And so sometimes it has nothing to do with health, which is why we've created these robust supplemental benefits like vision, dental, hearing, in-home senior support, a personal emergency response benefit, a benefit that allows you to modify your home with safety devices, because these are all things that normally healthcare plans may not think about, but they impact health.
You know what? That I'm about to scream. I'm so excited. When I was at the expo, I said, I just turned 50. I wish this plan was for someone my age, because you have covered every dynamic. So let's talk about some of the standalone things, because it's rare that you can get dental, vision in one program. I mean, it's like, really. And then let's talk about, if you could, the really great explanation from Luana Peters, who just broke it down. I mean, and I want to also target. Okay, stop, Claire. Let me get myself together. I'm excited. So let's talk about what Luana Peters suggests, which she mentioned, because one of the things that she said is that during the COVID process, there was someone that called her. Yes. And it kept that socialization going. I think that's one of the key things. We have missed socialization. We are doing this interview, yes, through the prayerfully last months of COVID. We don't know, but we started almost in the beginning of COVID, and you kept that protocol of staying in touch with your clients and making the phone calls. That's like what I consider the well-being checks. Yes. But you kept that going with your clients, and you provided masks and sanitizer. What was that COVID process like? Because it was done well, and she cheerleaded for it.
Oh, absolutely. So, COVID brought so much uncertainty, foremost. And one of the things that it was doing, and it was isolating everyone from their families. And the statistics show that for the senior population, depression was a result of the isolation. One of the things that we were able to do is send out COVID kits. And in our COVID kits, it educated our members about COVID. It provided thermometers, masks, hand sanitizer. These were things that you just couldn't find on the store shelves at that particular time. And then we had someone contact our members to keep in touch with them, to see how they were doing. When the vaccines were actually produced, we actually contacted our members to let them know if they wanted to be vaccinated, where they could go, and we help them set those appointments up for the vaccines. And so again, the Zing is about really being a high touch, high engaged health plan with the members that we serve, because the whole goal, and if you think about the word Zing, Zing means energy, vigor, strength, focus, force. Those are the things that we are trying to infuse back into the healthcare industry in terms of actually serving, in terms of benefits that actually make sense and they work for the member.
Mm-hmm.
So Luana is a member of Zing Health, and she just spoke so highly of all of the services that she received during COVID, and that went for all of our Zing members.
Absolutely. And one of the things that I am excited about is because what people don't understand is that we were truly in an uncertain situation.
Yes.
And then some offices actually closed down. So you to still provide that safety value and hey, we're going to do this with you. So let me ask you this. We now had to kick in telehealth.
I was just going to mention.
How did that work?
So at the time when COVID struck, all of our members had access to telehealth services.
Yes.
There were co-pays associated with it. We eliminated all co-pays associated with telehealth because we knew that our members may have issues getting in touch with their doctors, being able to make appointments. And so our telehealth vendor actually made calls to our members just to let them know that what services were provided. And so our telehealth vendor, which is MD Live, not only provided primary care doctor visits by board certified physicians. So this is not a fly by night.
Yeah.
This is not fly by night. These were board certified physicians that our members had access to that could make same day appointments. They could get urgent care visits as well as behavioral health, because our mental health was impacted by COVID.
Yeah.
So some people needed those behavioral health specialists, and even in healthcare, making appointments with behavioral health specialists can take up to a month, 2 months.
I know you said same day appointment. I'm like, whoop.
Yes,
Yeah.
same day appointments with behavioral health specialists.
Absolutely.
So that was just one benefit that our members received at no cost to them. No monthly plan premiums. This is in addition to all of the Medicare benefits that they receive under Medicare Part A and Part B.
Wow. So let's do this. Let's get to the meat. I think what is the maze is learning the parts A, B, C, etc., etc. So how do you want to address this? Because we will be back again, but how do you want to take this first episode rolling into AEP and explain to our audience?
I want to talk about the enrollment periods and what Medicare beneficiaries can do during the enrollment periods. It's like when you were covered under your group insurance at work. Every year, your employer gave you an opportunity to change your benefits or add new things to your benefits. The annual enrollment period is the same. Every year, Medicare gives Medicare beneficiaries the option to purchase or opt into a Medicare Advantage plan or a standalone prescription drug plan. You can add or change these benefits on an annual basis. And that's from October 15th to December 7th. And so you have, that time period to make the necessary changes, evaluate your coverage to make sure that you have the coverage that you need and for the upcoming year. We know that health statuses change, year over year. So you definitely want to ensure that you can evaluate, your health plan. And again, we have Medicare advisors to help you to do that at 1-844-YES-ZING or 1-844-937-9464. So you can definitely get help evaluating, your plan and your healthcare needs. The next enrollment period is the Medicare Advantage open enrollment period, and that occurs from January 1st to March 31st.
Mm-hmm.
This allows is any individual who are currently enrolled in a Medicare Advantage at that time, it gives them an opportunity to make one last change in that new year. So if you're enrolled in a Medicare Advantage plan, you can change your Medicare Advantage plan, or you can go back to original Medicare and pick up a prescription drug plan. So those are the two enrollment periods where we see the most movement between plans. But again, it's about evaluating your needs based on your healthcare status.
Absolutely. So, how long has Zing been around? Because you came in aggressively. I promise you. I said, wow. And Dr. Whitaker's like, we're expanding. We're going here. We're going there. I'm like, really? So quickly. So tell us about that expansion part, but just tell us the when Zing started, because it's very exciting.
Yeah, so everything was submitted in 2018 to Medicare. We started official enrollment in 2018 for January 1st effectives of 2019. We then expanded our service areas to include Indiana and Michigan. Currently, for 2021, we're currently in the Chicago and Rockford area, Chicagoland and Rockford area. We've also expanded for 2022 to 4 additional counties in Illinois. And so we're really excited about that. And of course, we're in 6 counties across Michigan and Indiana.
All right. So let's hear from Dr. Whitaker at this time.
Well, this year we started in January 1st, 2020 in Cook County only. Starting January 1st, 2021, we'll expand to 6 additional counties here in Illinois. And we're excited. We're going to be moving to also go to Michigan, where we'll be in Wayne County, Oakland County, and Genesee counties, and also to Indiana, where we'll be in Marion, Allen, and Lake counties. So we're only been in business going on 2 years, and we're expanding our footprint across the Midwest pretty dramatically.
He is no joke. Wow. And I can say that because in Indianapolis, when we were at the Indiana Black Expo, let me tell you, the community at large was so in awe.
Yes.
And I say that because, and it's been consistent as we've been in the community, everyone is happy to do their job and be resourceful and be informative to the clients that walk to the table. So that is a no-brainer. So that expansion period, I hope I have something to do with the one in Indiana.
Yes.
I'm working on that. But let me tell you, they came down and people said, "Ooh, they got the cutest colors." And the colors are soft. It's a whole, I got the Zing thing going. I understand what you meant by that. So let's say we got people who are just intimidated by the process.
Yes.
And we don't want them to be. There are so many experts. No question is a I don't want to use the word dumb, but no question is a wrong question. If you're curious and you make the call, someone is there to answer you and get you the questions that you need. So what we're also going to tell people is this: Zing Health, if you need it, we can do Zoom meetings. I mean, a lot of people are not getting out still, and I get that. We understand that. But you're more than welcome to have an expert call you. I'm going to get your numbers because the number that I shared was the one that's for Senior Talk. So that's one that I use. But there are other ways that you can reach out to the experts. So what does the next 3 months look like for you? Where do you need to be? Where does who do you look to cover? What areas, what communities? You got the line dance group still getting together. They got the people that stepping, all that together. So where do you need to be more impactful in the community for the next 3 months?
So for the next 3 months, we're throughout our service areas. And so our service areas here in Illinois, Michigan, Indiana, one of the things that we do is we work with the broker community. And these are people who are licensed insurance agencies. We have close to 4,000 licensed insurance agents, all of our service areas, and they're ready to assist. And so we're everywhere. We're definitely everywhere. And you can reach us by calling us at 1-844-YES-ZING, Z-I-N-G, or 1-844-937-9464. Or if you want to by computer, it's www.yeszing.com. But as you mentioned, Clara, we're definitely in the community. We'll be at the senior expo events, all of the senior expo events that are being put on across the Illinois area. We have several events slated. We have hundreds of events, I'm sorry,
Yeah.
slated for the annual enrollment period and open enrollment period. So you're going to see us out in the communities throughout our service areas. And one of the things, the primary goal is to educate the Medicare population about what their options are. Because if you understand what your options are, then you can make an informed decision.
Absolutely.
And that's the goal and purpose of Zing. The goal and purpose of Zing is not to enroll you in our plan. Our goal is to help you figure out what the best option is for you.
Isn't that something? That's a big one. Because you know, some people can be very selfish.
Oh my goodness.
But that's another show. That's another show. What we say is this. And the fact, and that is true, and that's what Dr. Whitaker even made the mention. You know, if we could just educate you and inform you, this plan may not be for you, but we hope that you get something. But we hope that we've been helpful to keep you more knowledgeable about what the best options are for you. And I said, wow,
That's so
that's big.
That's big. And I'll give you an example of that because we're not biased. Dr. Whitaker will say in a minute, if the plan is not right for you, do not enroll.
That's right.
Recently, my aunt is turning 65. She lives in Michigan. She drove up so that I could go over all of her Medicare options, took her through medicare.gov. We looked at different plans. She said, well, tell me about your plan because, of course, our plan is in Michigan. And after we went over all of the benefits, and I'm talking against big carriers, she said, why wouldn't I go with your plan? That's the best plan. Why wouldn't I go with your plan? So she's enrolling in Zing. I was not biased. I gave her all of her plan options and she chose Zing, not because, and she'll tell you in a minute, not because I worked for Zing, but it had all of the benefits. And let me give you an example, because we've designed these plans for people to access, because that's one of the main pain points with Medicare plans is that let's say they provide dental, but it may have a 70% coinsurance attached to the out-of-pocket. So I have it, but I can't afford to use it. And we took that barrier away. So dental is one of the main benefits that Medicare recipients seek after because Medicare does not cover things like vision, dental, hearing. Our dental benefit, they can get up to $3,500 in dental benefits, both preventative and comprehensive. And that includes partials, dentures, extractions, root canals at no cost to the member. They have a complete zero out of pocket up to their maximum benefit amount. And so that removes the barrier of access in terms of getting those dental benefits that they need. So on day one that they enroll in our plan, they have access to dental at day one at no cost to the member up to their maximum amount.
Wow.
That's better than my dental benefits.
Yeah, I'm talking to Dr. Whitaker. We need one for the. I need that plan for myself, and then I can roll. But that is tremendous. That's a tremendous offer. I mean, dental is a big thing, and let's be clear. Have we been to the dentist prior to COVID or even during COVID? So that benefit somebody should jump on that right away. So we are taking calls. I'm gonna share their numbers, but the Senior Talk number for Zing Health is 833-946-4937, or visit myzinghealth.com, and that'll be connected to Senior Talk to know that we're working in the community with you. So we're gonna share one more quick video. This was us. I think we were at the Black Women's Expo where they rocked it. We'll be right back after this message, everyone. Well, that was just a short synopsis, but I had to just share. We've been in the community together. When I say we hit Indiana Health Minority Health Fair, we hit Chicago with the Black Women's Expo. And let me tell everyone, if you have a community event, call my friends at Zing Health. First of all, you can call Senior Talk at 312-428 6919. I am a community partner. We are rolling with Zing, AEP, and beyond. First of all, we're going to put together some informationals. We'll also be sharing their schedule of where they're going to be in the community as well. So, Miss Sylvia, you've been great. We got to come back. We're going to do something. We got to dig more into it. We just touched the surface.
Yes.
We got to dive more into it. But if you would, give us your closing remark at this time. You've been awesome. Yeah. I'm so excited for us.
My final remark would definitely be I'm just extremely excited because one of the things that I told Dr. Whitaker and our co-founder Garfield Collins is that these plans have the ability to change lives, and that's what I'm really excited about is the fact that we're providing health care that provides health equity to our communities, which we've not seen some of those things in times past. But Zing Health gives people an opportunity to get the health care that they need. We're backed by doctors. Some of the plans, some of the providers that we partner with, such as Oak Street Health, is backed by AARP. They've endorsed a provider group, which is never done before. Our Zing is actually founded. Our co-founder is an arm of the American Medical Association. And so this is not something that this is not a fly-by-night, organization. A lot of thought has been put into how we can actually design benefits that work, provide quality health care, and ensure health equity in our communities.
Absolutely. So, everyone, we're going to put the number out once again for you. Please use the Senior Talk number, as Zing Health is one of our sponsors, and they are a premier partner for this AEP experience. I tell you, it's going to be an experience, but you can definitely get the education you need. So visit myzinghealth.com or call 833-946-4937. Thank you so much. You've been awesome. And everyone, thank you for viewing our show. And what we want to do now is we want to also note that we are showing this program in the spirit also of what we call one of our primary disparities, which is breast cancer. So if we could take a moment, I just want to show this video to our viewer listening audience, and then we're going to close out our program. Everyone stay tuned. All right, everyone, thank you for taking that time out. I just want to acknowledge, because every day, as my friends say, Tasha joined the foundation, every day is October for some woman or even man, and we want to give them that acknowledgement. So everyone, it's been a whirlwind of a day. Thank you for making us a part of your day. Don't forget, AEP is just around the corner. Just around the corner. Please remember to call Senior Talk office at 312-428-6919. We'll put you in touch with Zing Health if you have an event, anything that you can think of. I mean, block club party, red hat meeting, all of it. They will come and they will be informative at all times. So it's been my pleasure today. I am Clara Hubbard, host of Senior Talk, and we look forward to seeing you soon. Everyone, take care.